We're going to educate our client in some scapular stabilization exercises. So if the shoulder is stiff or she has that forward posture, she's going to get some knowledge in how to sense where her shoulder blades are in space relative to her arms moving around. So in order to do that, we need her to wake up some of those rhomboid and middle trapezius muscles in between the shoulder blades so she feels those contracting. We do so much in front of our bodies that these muscles tend to become overstretched and they get weak. So you want to facilitate those muscles with a little bit of tapping and bringing the patient's attention to that area for some neuromuscular re-education. So what we're going to do today is focus on getting your shoulders just a little bit back, so pinch the blades together a little bit and a little bit down, because we tend to keep our shoulders too up and too forward. Just going to pinch these. You feel where these muscles are? I want to feel them contracting right there. Squeeze really hard so you get a good sense of what they're like, and let go. I give you about a 50% of squeezing back, so she's doing some scapular adduction, scapular retraction, and hold it there for a few seconds. Keep your head right in the midline. A little bit of height there, good. So a nice neutral cervical lordosis, and release. I do a couple in a row, so you want to really focus on those, the mid-scapular region. Feel these blades coming back. Hold them there. Give it about 10 seconds. Keeping your head in a nice position, nice neutral position, and release. So we do a series of that, 5-10 reps, depending on how quickly she is fatiguing. Pinch back again. And as the therapist, come in, check out from the posterior side, are the scaps level? She tends to hike up a bit on that left side. Check out that inferior angle. Check out the lateral border and release. And you feel like you're getting a little clicking in here when you're doing that? Okay, so bring this one down a little bit and back. And both together now. So I'm trying to just balance them out a little bit. Hold that there. Now holding your shoulder blades back, how does that feel?
It's good, it's like stretching it.
A good stretch. Feel a stretch in the front when you do that?
Yeah.
And breathe into your belly. So have them incorporate the breathing, because so often they're using stress muscles, accessory respiratory muscles to breathe. So while she's stretching those, we're breathing into the belly. And release. Now see what it's like to feel the difference with having relaxed shoulders. Raise both arms up overhead. All the way up. Reach, reach, reach. And check the difference between the two shoulders. You got a little bit more space here, a little less abduction on the left than the right. Look at the difference in the position of the scapula. So see what that feels like. Come on back down. Now this time, bring the shoulder blades back again. So pinch a little in here, hold it, hold it. Drop this just a little bit. Just a little, not quite too much. And holding that position, we call that stabilizing your scapular muscles. Bring your arm overhead. See what it feels like on one side as far as you can reach. And coming back down slowly. And keeping that position here, try it with the left side and see what that feels like. So the client's getting acquainted with what it's like to move one arm, keeping the scapulas in a nice neutral position, and back down. And take a rest a moment. And breathe. And when you're ready, we're going a little faster than we would with a client because we're videotaping. Bring the shoulder blades back again, a little bit down. Nice neutral posture for the neck. We would have worked on that separately. Now bring both arms overhead, keeping those shoulder blades back here in our neutral position. And reach. Do you feel how that's different?
Mm-hmm.
Tell us how it's different for you.
It's like stiff, but in a different way. Like it's easier to do it now that I'm more relaxed, I guess.
Okay, and breathe into that. And relax. And try a few repetitions. See if you can keep those shoulder blades back there. If she loses that control, we stop the exercise right away. So blades back a little bit, lifting up both arms overhead. Maybe try a few repetitions in a row. You could even look in a mirror at home and try the same exercise, keeping those shoulder blades a little bit down and back. And see how many repetitions you can do before you lose this and you start to see this shoulder hike it up in the mirror. One more time. Blades back and down. She lost a little bit on this side, so 3 reps is really her max. We would have her do a couple groups of 3 with some rest in between, maybe a minute rest, and relax. That's a nice way to get the scapula, adductors working, middle trap rhomboid. Start working with some of those a little bit more. During the day, just be aware too, bring your blades back and a little gently down. So maybe sit in your chair at work. sit in your chair at breakfast, just work on a couple of those, holding for 10 seconds, releasing gently, and try about 3 to 5 reps in a row. Start to get used to getting those shoulder blades back. As you start stretching some of your muscles in the front of the shoulders, it'll be easier to line up your posture for your shoulder blades to be in a perfect position.